So I'm here with Rafiq Hasan, Global Head of Ophthalmology at Bayer. And it's such a pleasure for him to be here with us because he's a bit of a fashionista himself.
Oh, you're too kind, man.
We're going to get some pictures or something of his socks later, but he's in purple with mustaches, I'm in orange with monsters, and we're having a good old time here about to talk about design.
Absolutely.
As it meets the world of ophthalmology. So thanks for joining us.
No, great to be with you, man.
That's great. And again, we're covering this because it's all about our issue here at Pi Magazine, where we're talking about fashionable aspects of the posterior segment. What are the trends today?
Yes.
But before we get into that, Rafiq, I just wanted to talk to you about your own life in terms of design. Right before the camera started, you were telling me a little bit about the importance of being memorable in this day and age. And how have you done that in your own life?
So, you know, I like to be, like you guys, a trendsetter.
Yeah.
You know, to me, Pi Magazine is a trendsetter in making the world of ophthalmology memorable and different.
Right on.
And in the same way, you know, when we think about how we interact with different stakeholders, how do we be memorable?
Yeah.
And me personally is always thinking, how do I make sure that when I interact with somebody, when they walk away from that interaction, they're going to remember me for something interesting?
Yeah.
How do you make sure that you bring a new insight into a conversation where it will challenge the way they think, for example? And that is something that I've always valued in interactions, and often when I'm discussing with people, I'm trying to learn and take new insights that I can then pass on to others. So in my life, I'm always hoping to be the one who brings something different and something new.
You said something interesting earlier too about simplicity, and we were talking about iPhones, something that I have in my hand here. And certainly Steve Jobs was an advocate of design simplicity, something easy to use, beautiful, functional. And you've been able to do that essentially with EYLEA. I remember it was one of the most successful product launches in Australian history back in the day. And it was interesting because you're basically reducing the frequency of injections as an efficacious drug, but it wasn't that much of a change, and yet it was a blockbuster. So that simplicity worked as a design aspect.
Absolutely, and it was very interesting, you know, when I would talk to retina specialists. Often they would tell me one of the biggest challenges they face is just the capacity challenges of treating so many patients. You know, the demand for effective treatments had increased significantly since anti-VEGFs were introduced. But then the challenge for clinicians was so many patients coming back so frequently, either for treatment or for monitoring. And like you say, just the simplicity of a message that says, you may need less injections, resonated very strongly. And I think that was one of the keys to the success.
Amazing. Well, any fashion tips out there for ophthalmologists as well? I had mentioned that I had remembered you wearing red pants at the WOC in Tokyo back in 2014. It's very distinctive. I remember it. What do you do to be memorable in this field?
So I think coming back to that design thinking, when we think of our industry, often, you know, it's very complex, a lot of fantastic science. But like you say, it's also matching that science to what's happening in the world of our understanding of different diseases. So when we think about the future, you know, how we treat different diseases, it's matching that design of maybe, for example, in retinal conditions, understanding the different pathways and then designing molecules that actually address those pathways. And I think, you know, we're doing that today in terms of how do we address the different elements, for example, with diabetic eye disease, and being able to design the approach that we have to match those conditions. Another important element of design for me, and being part of that trend, is you know, we all want to be individual in our personality and how we're perceived, and we should apply that same principle to how we treat patients. So, for example, when a certain patient comes forward for treatment, how do we ensure that that treatment is personalized to them? And one of the big trends we're seeing today is this shift towards what we call treat and extend. And that individualization of treatment in terms of saying, okay, the disease may be of a certain type, a certain level of activity in the patient? How do we make sure that when we treat them, we're following the right fashions, the right trends? And I think Treat and Extend is certainly one of those.
Are you talking about a tailored approach by chance?
I think so, absolutely. Very much a tailored approach. And finally, to appreciate fashion, we need vision. We need eyesight.
Right.
It's so important, and it's something we all cherish and often take for granted. But I think it's sometimes important to step back and reflect.
Right.
That actually we often have such a big impact on people and their ability to live very fulfilling and rich lives. And it's all about vision ultimately. I think ultimately we want to be in a position where we're giving people around the world that opportunity to really benefit from maintaining or gaining vision and being able to appreciate your socks and your shoes and those trends.
Whoever would have thought socks would be comparable to ILEA?
But there you go.
If that's the case, I know what I'm investing in next.
Fantastic. Excellent, man. Nice to talk to you.
You too as well. Well, thanks for joining us, Rafiq.
Super. Always a pleasure.
And we'll see you in Amsterdam next year.
Definitely.
To talk about
wear orange next year.
I hear that. Yes, sir.
Super. Nice to see you, man.
Absolutely.
Thanks very much.
Take care.
Thank you.